Hello, I'm Ireland, and I'm going to be presenting over the disease of tetanus. The Clostridium tetani is the bacteria that causes tetanus, and another name for tetanus is lockjaw. As you can see over here, I have a picture of the Clostridium tetani bacteria. They're very noticeable of the shape because they look like little drumsticks. So let's move on. The signs and symptoms of this infection is your jaw cramping, that's why they call it lockjaw, muscle spasms, they're sudden and involuntary, and they're often in the stomach. It's painful muscle stiffness all over the body, trouble swallowing due to the tightening of your mouth and throat, jerking or staring. This can also be causing seizures. Headache, you can get fever and sweating, and changes in your blood pressure and heart rate. The causative agents of infection is, like I said before, the bacteria Clostridium tetani, and this bacteria lives in soil, saliva, dust, and manure. The bacteria can enter through a deep cut or break in the skin, for example, stepping on a nail or through a burn. Some virulence factors and pathogenesis. The virulence factor is the tetanospasm toxin. It's an exotoxin that's extremely potent and causes the destruction of tissues in your body. And as you can see on this little picture I have over here, this is just the evolution of the spore and how it grows its little shape, little drumstick shape, like I mentioned before. The pathogenesis is the spore and vegetative cells enter through the wound. The spores in the anaerobic condition germinate. This tetanus exotoxin can spread throughout the blood and also the lymphatic system. Then it blocks the inhibitor impulses by inhibiting the release of neurotransmitters. And this is what leads to the spasms and also other complications. The diagnosis of infection. Most laboratory tests are not helpful in this diagnosis. Doctors really use the diagnosis based on specific signs and symptoms. Some of the signs and symptoms that I mentioned earlier: tight muscles, headache, fever, and trouble swallowing. Ways of transmission and epidemiological data. Like I mentioned before, the transmission of the C. tetani is through the exposure of a deep tissue wound to spores which are present in the soil or fecal matter. It's most prevalent in developing countries where the immunity is low and also where natural disasters have occurred. All ages are susceptible. I mean, anyone can get a cut and be infected by this bacteria. If it's not treated with medical attention, it could end fatally. Neonates are at high risk in underdeveloped countries due to this non-sterile medical equipment. So whenever a newborn is born and they're cutting the umbilical cord, if their equipment isn't clean, then that's how they can receive this bacteria and be exposed to it. And they're babies, so that's not good. But over here you can see that I have two graphs, and on the bottom one there's two big sections, and you can see it's South Asia and the Sub-Saharan Africa, and those are developing countries. So once again, it shows you how much cases they have, this is the number of deaths, the number of deaths that they have. You can see in that little green sliver there, that's North America. That just shows you that due to the vaccine that we don't have as many deaths, near as many deaths. The top graph, you can see the blue bars represent the cases of tetanus, And you can see that they've gone down over time because of the vaccine. So that's a good thing. So like I've mentioned, the prevention and treatment, the main prevention is the vaccine, and it's called the Tdap or the DTaP. And it includes the tetanus, diphtheria, and also pertussis. So that's the main prevention, the main way of not getting this disease. The treatment is a combination of passive and antitoxin and active immunization. This is based on the tetanus toxoid. Antibiotics are also used to treat this infection, and you might also need supportive therapy and maybe even assistant of a respirator. Thank you all so much for listening.